Good afternoon, everybody. This is Dee Reinhardt with Illinois WorkNet. I have on the phone with me Olivia Miller. It's so hard for me to say that.
Hi, everybody.
We've got a jam-packed agenda, and we have a lot of stuff to cover. So we're going to get rolling right away with the numbers from the dashboard. And I am still sick, but I am getting better, so I'll try not to hack too badly into this recording. All right. Okay, so I did the numbers today. The one past due for Cottage Grove has been taken care of. They are currently ineligible, so they were updated, so that is no longer due. We do have one customer that's required enrollment from OAI, so Christina, if you can get that taken care of, that would be super duper fabulous. We only have a few 2151As past due, and a number of them are ones that I have to take care of for Cottage Grove and Roseland. And otherwise, if you guys could, and I've got to do Rock Rivers as well. So otherwise, there's some ones out there. So if you guys can take a look at those for me. If you've got any questions, please feel free to email me. Minimal progress, we've got 3 single ones out there. Please make sure that you update a conciliation 2151 after you have mailed out the appointment. And then the same thing with the no progress. And both of you guys that have the no progresses are in voluntary counties, but you can still update with a conciliation appointment and see if you can get these people to show up. If they don't show up, drop them from the program. Completion status, we have several. Again, we've got 4 in Springfield Urban League, so Courtney, you need to take care of those. And SNAP ineligible, a bunch of ones. Please check to see what you can do with those and have those updated. All right, and then I didn't do packets because today is only the 9th of the month, so I didn't want you guys to have to worry about that. So what we're going to do right now so that we can make the best use of our time today, we have Margaret Dunne from Department of Human Services who will answer any questions that you have about the security control questionnaire. And those documents are down in the CBO TA files if you do need to download those again to remark those or update those. And we did discuss this at both of the CBO training sessions, and we did have a couple of questions. So if you have questions about them, we do have Margaret on the phone right now. She can, if you type your question, we can get her to answer those for you. And while you're typing, I'm going to tell you that as of right now, we are still on target for May 14th to go live with the new cohort. So there are a couple of things that we need you to get taken care of in the process, and we will do those after we're done with the questions for Margaret. All right, Carmen is asking, so Margaret, this is for you, and I think you're logged into the webinar, aren't you?
I am, but it's frozen, unfortunately. So.
Okay, so I will read to you just so that it is in the recording as well. Our CIO used a digital signature to sign off. This new agreement does not say that this is not allowed, but the old one did. Should I have him re-sign, or is the digital signature sufficient?
The security officer is now accepting digital signatures.
Okay, so that answers your question, Carmen? She's saying hooray, thank you. All
yeah,
right, and then
make it a lot easier.
yeah. Kelsey is asking, when a customer completes EPIC with 90 days of employment but becomes SNAP eligible again, how many times do we have to serve them again? Does that have something to do with the security control questionnaire, Kelsey?
Nope.
Okay. Okay. So then next, Margaret, when will we have our approval of the questionnaire that has been or will be submitted? How long does that process typically?
It all depends on whether or not there's problems with the questionnaire. So generally what happens is when they're sent to me, I do a quick screening of them. And if I note anything that's a problem, I'll send it back to the agency. If I don't see any problems, I will forward it to the security officer for final approval. They do have somebody that is designated right now that's reviewing those, so actually they're being reviewed and approved pretty quickly.
Okay. But you would get back to an agency if there is a problem prior to submitting them, correct?
Correct. And I usually get back to them within 24 hours of receiving it.
Okay. And then will the agency receive some sort of confirmation that they have been approved to participate, or will it just all of a sudden one day magically appeared?
No, they will get an email from our security office saying that their SPCQ has been approved. But that's just one step. We also have to, other forms that have to be completed before they're added to IES.
Okay. Now, one of our EPIC providers is also a SNAP ENT provider or another DHS grant. Do they have to send something in specifically for EPIC, or will the document that was originally submitted for the other grant cover them for this one?
Oh, it will definitely cover them as long as the information is the same site, same security controls in place, then that SPCQ for their agency will suffice.
Great. And did I hear something somewhere that they have to be renewed every year?
Yes, they have to be resubmitted every year and any changes documented. If there have been no changes documented, then they can just resubmit with a new cover page and new signature page with the correct date on them. The entire document has to be resubmitted, but they can use the same document as long as that first page and last page are switched out if they've used the latest version of the SPCQ. So right now we're on the 4.1 version of the SPCQ. It has improved quite a bit. It's much shorter than previous versions and easier to complete.
So you said the 4.1 SPCQ is current.
Yes.
Okay. All right. Carmen asked, what address do we send this to other than, somebody moved, do it DHS MIS security at illinois.gov?
They can actually send it directly to me, margaret.dunne@illinois.gov.
Margaret, R-E-T, M-A-R-G-A-R-E-T, I'm typing it.
Yep, M-A-R-G-A-R-E-T dot D-U-N-N-E
at illinois.gov. Okay. All right, I just put that in the chat pod. And then Carmen also asks, what are the additional documents that you were referring to, and when would they receive those?
So the other documents that are required before we can add users to IES is a valid data sharing agreement, and I would imagine that you are coordinating those data sharing agreements.
I'm not.
Okay. So if the agency already is has completed one for SNAP or for TANF, they don't need to complete a new one, but if they are an agency that does not have a data sharing agreement, then we do need to have a data sharing agreement sent out to the agency for signature. And generally that is the program staff that complete those forms. We are also now requiring a business associate agreement as well, because all users in IES will see HIPAA protected information. So we are having agencies complete business associate agreements as well.
Okay. And are those two documents going to be sent out by you or by the CIO once they get the
Actually,
application?
that is generally the responsibility of the DHS program staff, liaison with whatever program it is.
Okay.
For example, for TANF and SNAP, Olivia sent those out to her agencies.
So would this be Deidre that would need to send those out for EPIC?
Yes.
Okay. All right. So we'll get, if you could make sure that she has those documents, that would be wonderful.
And those documents are sent out after the SPCQ has been approved, correct?
Yes, generally speaking, our legal department likes to see the SPCQ approved before we send out the data sharing agreements.
Gotcha.
Okay.
Thank you.
And Deidre's typing right now, so.
And I do see just on your list of agencies that there are quite a few of them that already have data sharing agreements in place.
Okay. And then Judith is asking, they haven't received those documents. What is the time frame after submission that they would potentially be receiving something? You know, is there? I know that you said earlier that it's coming around pretty quickly, but because you have the dedicated person. But is it a day, a week, a month, or several months?
I would say as long as the turnaround from the agency is quick, if we're asking for revisions to the document, it could be done within a week.
Oh, nice.
So I screen them within 24 hours. The agency sends it back with any revisions we've requested. Then it goes on to the security office. I will say one thing that sometimes hangs up the time frame is if an agency is using an outsourced IT company, an outsourced shredding company, or an outsourced data storage company, we need to see contracts from those, a signed contract from that vendor. That needs to be submitted with the SPCQ as well. And it should
Olivia,
have
did you get that?
confidentiality language included in that contract.
And you said that's an outsourced company for data, and what were the other two?
Any outsourced company you use that sees your, potentially would see the IDHS data. So generally speaking, that's an IT company because they have access to your computer system, a shredding company that you use for documents because they could potentially see our documents, and storage, again, because they could potentially see our documents.
Gotcha. Thank you.
Sure.
If they scan in-house, that it's only if they have external storage, right?
Correct.
Okay. Deidre's asking, she needs to know who has data sharing agreements in place so that she can send out the additional documents. So if you want to type in the poll pod that I just put up, who has a current data sharing agreement to receive the additional documents, please type in there so that we can get those answers to Deidre so that she can get you the extra documents.
And I do have one more question. So if they are using an outsourced company, those outsourced companies then need to complete the SPCQ as well?
No.
No?
We just need to see a copy of the contract between that outsourced company and your agency signed by both entities, and it should also contain language regarding privacy of data, confidentiality. It should have a confidentiality clause within the contract.
Gotcha.
All right, so now it looks like Judith from a safe haven submitted her documents, it looks like over 4 weeks ago, plus the additional documents, and she still hasn't heard back yet. So Judith, Margaret, should Judith send you an email directly?
Yes, have her go ahead and send me an email. I know that some agencies were just submitting directly to that DHS email that is on the SPCQ, and those were sometimes getting misdirected. So it's really better if you just send directly to me.
Okay. All right, and then Krishina from OAI said we submitted a data sharing agreement but haven't heard back yet.
A data sharing agreement or an SPCQ?
Krishina, answer that, please. Judith submitted to you, Margaret, and you actually helped her with a couple of questions.
Okay, and then she turned around and resubmitted it?
Autumn sent theirs to Margaret Dunne. That's Mantricon. I'm waiting for Krishina to, she sent the data sharing agreement. So, Krishina, have you already submitted the SPCQ? Wait, I did that wrong, didn't I? DSP.
Nope, SPCQ, you're right.
Okay, and then Judith sent with the outsourced for shredding.
She sent a document.
Yeah.
I will take a look and see where things stand with hers, and then I can respond to her directly. But Judith, if you'd like, if you could just send me a email just so I have that up on my most recent email, I'd appreciate it.
I think Krishina should probably send you something as well.
Yep, if she thinks that she sent me an SPCQ, I don't recall getting anything from OAI, though. And the data sharing agreements should be going directly to Deirdre.
Repeat that one more time, please.
If it's the data sharing agreement and not the security questionnaire, those should be handled through Deirdre.
Okay. So Deirdre needs the business associate agreement and the data sharing agreement. You need the SPCQ.
The template.
Okay. Okay, Krishina said to watch for something this afternoon from OAI. Good. And I'm sure Judith will get hers out today too. All right, does anybody else that doesn't already have an agreement in place, I don't know if Margaret knows the answer, but we can ask the question. IBIZ, will that be showing SNAP benefits in the future? Do you know anything at all about that?
About IBIZ?
Correct.
No, I'm strictly dealing with access to IES and PACES.
Okay. All right. So we'll see what we can do with your question there, Kelsey. See if we get another answer from you. Okay. All right. Does anybody else have any questions for Margaret so that we can get her back to her desk? I don't see anybody typing about the data sharing business. And otherwise, if you have other questions, we have Margaret's email address in the chat pod. We will include that with the notes that we'll send out. And you can always get in touch with Deidre or Olivia or I, and we will forward those questions on to you. So thank you very much for your time this afternoon, Margaret. I know it's easier to get a whole bunch of questions all at one time than getting them trickling in. So I appreciate you doing this for us today.
No problem.
Thank you very much, Margaret.
Okay. Bye-bye.
And Deidre's asking that if you send any questions to Margaret, please copy her on them as well. All right, so now let's move on with the next item on the agenda, and we need you guys to have intake orientation appointments included in the calendar at least through the end of July. I do know that I checked a couple of agencies the other day. One of them had them through the end of December, so wahoo! We did have some confusion that I got fixed with our programmer who's working on the new cohort. He had a couple of agencies that were not EPIC providers listed and accessible, so I think that's what the confusion was. So I got him to associate the proper agencies with the EPIC scheduling tools and all that kind of stuff. So that should be fixed. And okay, so if you can update those appointments. And then we have an update to appointment dates for you guys. I know on Friday we had a major discussion about what you should name your intake appointments for the customers. What we decided on Tuesday at our admin meeting was that DHS is only going to do verification of eligibility. They are not going to reschedule anyone. They will schedule customers to come to orientation, so you still need to determine whether or not you want re-engaged customers at the same orientation that you want new cohort customers. So you still do need to make that decision and differentiation in your appointments if you are going to differentiate them. But the outcome of this is, if DHS is able to verify eligibility prior to the time period that was for the original appointment, they will show up as verified eligible and scheduled for appointment. And if you're seeing that somebody is in your list and they're scheduled for the 22nd, but you have an opening tomorrow and you can get a hold of them by phone and get them into your agency early, you are welcome to do that. They will not be held accountable for missing an appointment until they miss the originally scheduled appointment that was sent in with your invitation. The customers will complete the application at your agency. That was the way it was going to be and will not change. All right, so any questions about the invitation dates right now? I'll give you just a second to type if you need to type. Okay, next thing on the agenda is update to, whoops, I know this question has been asked before, but I still need clarification. How many times do we have to make set re-engagement appointments for customers who have already shown they do not want to take part in the program? We have to discuss that at our next admin meeting. Olivia, can you add that to that agenda, please?
Yeah, can you say it one more time? I'm typing, I'm behind on notes.
It's how many times do the agencies have to re-engage a customer who has already shown they do not want to take part in the program? We were trying to, we had this discussion in Southern Illinois at the CBO session that we had, and there are customers who perhaps have been sanctioned for cause because of some incident that happened at the agency. And I said that I was going to check into how we could reject those customers, and I have to work with our programmer to see if there is a way, because what he thought would work didn't when I tested it. So we have to work to see. The only other thing that I could suggest to you is that you just reject the referral. But that doesn't, it doesn't work the way that we thought it would work. So we'll take that up on our admin meeting and see what the process is and what we can set as a limit if we need to. No, that's what we were trying to do, and it doesn't work, Kelsey. You can't reject the referral before the customer attends the orientation. That's what we tried to do, and it just didn't work properly. Okay. All right. Your training programs. The DHS offices are going to need printable copies of each of the programs that are being offered through this program. So you need to have the updates to your training programs completed by Friday, because we are going to put together a PDF document to initialize all of this and have that ready to go for Monday in the EPIC Partner Resources area of our resources. So you need to go in, make sure that any success ratios, any placement ratios, any information about your program is available in that program description. And we talked about making it sexy. Well, make it saleable. Make it something that somebody just doesn't want to pass by. The fear of missing out is something that they might want to consider if they were going to participate in your program. So please check on those program descriptions and have them done by close of business on Friday the 11th. Now, I'm going to share my screen, and I need you guys to look at a document that I'm going to pull up here. What we're going to do for DHS so that they can pick the right primary contact for your agency when they refer someone to you is mark on the CBO contact sheet who the primary and secondary contacts are for your agency. And then what I need to talk to Cody about this, but I want to try and do another piece, probably for sustainability. But so this does not mean that this is money primary contact. This means that this is for customer primary contacts. So I've kind of designated Frank from a safe haven because he's dealing with most of the customers. Judith, if you want me to make it you, I'll do that. Joe, I'm designating him as Albany Park. Anila is the customer contact. Kendrea is from Catholic Charities. should Bon or Abram be from Central State SEER? So I need to know who you want to be your primary contact when it comes to dealing with customers and DHS. So if there is someone from your organization that you want designated, I need to know. This will also come out in the notes so that if I don't have an answer by Friday, I'm going to be calling you up and saying, all right, who's it going to be? Okay. So as you can see here also, if there's any changes to this document, I need to know that as well. If there's a different phone number or if there's a different email address, I need that. I think Tammy took off with my one that was going around the room on Friday, so I didn't get that back. Okay. Can't get my screen pulled down. There we go. All right. Okay, so Olivia, I didn't see this poll question under here. Do we need to ask that question? Have you completed the IDHS SPCQ?
Yes, Tammy wanted that as a poll question.
Okay. Careers de Mayo event. There is a handout in the CBO file pod, and that is, I think Kelsey sent that to us as an opportunity that she wanted to share with her friends in Cook County. So if you want to download that and take a look at that, it is a job fair, I believe. I think I looked at it a little bit. And so you can talk about that. Tammy, I need to unmute you. For this next agenda item. So, budget modification.
Good afternoon, everybody. Can you hear me?
Yes, ma'am.
Good deal. Sorry I'm late. I had another meeting I had to finish up. Okay, so I gave everybody, where are we at on the agenda? Are we talking about the modifications?
Correct.
Okay. During our training sessions, I gave everybody a copy of what you guys submitted in March when we asked, you know, if we did a new cohort, how much would you need and how many do you think you can serve, considering that you're in charge or you have the ability to do your own recruitment. And so since then, we had these, our training sessions, and we talked about adding some new work-based opportunities, including OJTs and apprenticeships to the program. There is a little bit of clarification I still need to get from FNS, but if you're going to be doing this, go ahead and add that into your budget with the modification. So basically what I need to know from everybody is by the 18th, are we going to be adjusting your service numbers considering that we're starting in May and we're going to be ending in February? Do we need to address your outcome numbers? And do you need to relook at your budget figures and change your budget based upon your current expenditures and what you anticipate that you're going to be spending between now and February? Keeping in mind that the caps on the categories are 10%. Where we still haven't officially got the FNS approval letter, but we've had correspondence with them. So it's 10% for administration, 40% career navigation, and 50%, a blend between training, paid work experience, and also support services. So if you are doing, as I say, some OJTs, you would put that in the work experience line item if you're doing anything that's related to like an OJT cost.
What was the middle one, Tammy?
The middle.
10% admin, 40% blend, and you said one in the middle.
10% admin, 40% career navigation, 50%, which is allocated to direct costs for participants, so that's training, work experience, or support services.
Thank you.
If an apprenticeship, does it have to be a registered apprenticeship? Judith, send us information on what the apprenticeship is. Pre-apprenticeships are also an option within the work-based learning component. So we would want to take a look and see exactly what that specific apprenticeship is looking at. So, and my question is, and I can do by raise of hands, should I resend? I've got the emails from you. Do you want me to send those back to you with the file and information as far as, I would like to try and have this back by the 18th of this month if possible, because we need to have all of these modified before the end of the state fiscal year.
All right, so Carmen says yes. Phalanx says yes. Safe Haven says yes. Albany Park says yes.
Okay, so I've got Safe Haven, National Label, Albany Park, and Jeremy, I think I got that one back from you already. Was that Albany Park one of them?
Yeah, that was
Phalanx?
Joe Hempel.
Joe?
Hempel.
For some reason, I think I've already got it, but I can communicate with you outside of this.
And
I think I got it back
Phalanx,
from you already. And then who
Phalanx
else?
said yes.
Phalanx, okay.
Phalanx said yes.
Okay.
And then I got a question here. Autumn is saying, is it okay to do stipends for adult GED?
It is not. And we just had a conversation, we got that from FNS, that it's, we cannot add stipends because it's outside of some of the services that we've offered for the treatment group. So stipends are not an option.
But you can enroll them in work experience while they're doing GED.
Exactly. So we really want you to use the paid work experience, and then we want you to look at the other work-based learning opportunities. And we provided that document. It's a DOL document that's a WIOA desk reference that talks about work-based learning and gives you an overview. And then we can definitely provide a training on, if you want just specifically on OJT, we can do that.
Autumn, I answered you that earlier today. They have to be 18 years old. That was like, you ask Mommy and she says no, so you go ask Daddy. All right.
And I think, and I haven't talked to Dee about this yet, but I think we might try and do maybe even sometime maybe later next week, do a webinar for the CBOs again, just on the intake process. Dee's been so busy, and she's doing, I don't know, you have about 7 or 8 or 9 webinars she's doing this week for DHS. So, you know, if we guys need a refresher, I think it wouldn't hurt to do a webinar and record it to walk through the CBO process again on the intake side.
And we will have some changes by Friday, so I am doing a recorded webinar at 10 a.m. on Friday that will be DHS. You're welcome to attend it because the invitation process is very similar, but then you'll also see what the DHS side of things looks like. The dashboard is the same for both of you. So if you want to attend that webinar, it will be 10 a.m. and it will be in the Epic TA webinar space. So I'll put the address in the chat pod. Tammy, we've had a question from two kind of different people here. What we need to discuss, and we're going to put it on the agenda for Tuesday's admin meeting, how many times does an agency have to serve, try to serve a customer for reengagement?
Yeah, and I think Kelsey had a question related to that. I know the conversations, and it's not, we will address this once again in our admin group. I know that we've had this conversation with FNS before, as far as, reserving customers that have gone through the entire process. And so we'll revisit that. And we need DHS to respond to us as far as, based upon their policy, what they will allow and not allow regarding reserving people. And, one of the things that we have had communication about is if they dropped out, say they just started the training program and then they dropped out and they came back to you, you can re-enroll them and continue them in the training program because they, didn't receive that services. But I understand, Kelsey's questions is, if they drop out and you've paid for the training and they come back and you put them in training again, to be able to pay for that training again. And like I said, and we're reviewing the performance matrix also along with this because we want to make sure that the performance system isn't prohibiting you guys from serving customers and you're rethinking, oh, do I want to do a paid work experience or not? We want you to be able to do a paid work experience and do everything you possibly can to move these customers. So that whole performance model is under review right now. It's a great part about pilot projects is we can be flexible as we're moving along and see what's working and what's not. And Kelsey, yes, we will get that in writing for you. But that will be discussed on our Tuesday call with the state team and DHS because we need their input.
So for the webinar that's taking place on Friday for DHS, is that the webinar?
And I'm going to record.
Okay. So do we have a time set for the next time we're going to meet with the CBOs to go over the new intake before we kick it off on the 14th? Okay. We're just tentatively going to try to host one.
Well, I'm inviting them to that 10 a.m. webinar.
On the 18th?
On the 11th.
On the 11th. Oh, okay.
Because I'm doing a special training one for DHS on the 11th. So I'm inviting DHS to come to that webinar. I'm inviting the CBOs to come to that webinar if they want to see the process one more time.
So Olivia, could you send out that with a link to our EPIC distribution list?
Yeah, I'm gonna.
And the phone number.
I'm gonna include all of it in the minute, so they'll have all the info.
And the application process isn't squared away yet, Kelsey. So, but what we are doing, the application will be in. If you go to your Illinois WorkNet dashboard, where you log into Illinois WorkNet and you go to your dashboard, and that's where you click on the EPIC circle to get to the EPIC program stuff, it's the same thing that the customer sees, only they get taken to their EPIC dashboard, which is different than yours, and they'll be able to access their application there. The other thing that we're going to do is include on the application page those directions for where the customer needs to go. But it's getting worked on right now. I was testing at 11 o'clock last night, and the application will be the same. And I was I'm still finding things as we're going through processes. So. That recording will get posted the same place where these recordings will get posted. So you can check the EPIC partner page and look for the training where we have that. All right. Anything else? This is a jam-packed webinar today.
Carolyn did have a question related to the unemployment benefits and if they're exempt, if they can still participate in EPIC. And we're going to take that to our state call on Tuesday also. There was at one time, if I recall right, that they said unemployment benefits, if they received unemployment, they could not participate in EPIC. But I want to revisit that on our state call. So I've asked Olivia to add that to our state call, and we'll get back with you on that. And I think, and then Autumn, you had a question, can we enroll customers in training programs if they are ending after February? Does that affect the benchmark report? You know, the thing what I would do with those particular customers, if you're enrolling and they're not going to end, you have to have a way of obviously paying for those services. So I assume they're going to be co-enrolled in WIOA or some other training program. So these customers would be exited as entered, you know, training, higher level training. So that would be a good positive for you.
All right. Olivia, you've got the EPIC training program closeout timeline document in a file pod in here. Do we need to share this out and show everybody? What we have, folks, is we've got the
No, Dee, that's the
program.
old one. Sorry,
Okay.
I was on mute. No, I
right.
think that just got pulled up. I did a new one and sent it, but it hasn't been approved yet.
Okay. So what we are going to be doing is programs that are longer than the time frame left to be able to participate will not be offered to customers unless you're going to co-enroll them in WIOA. And at that point, then you can add them, but that will not be their first choice when they're in a DHS office.
So right now, I know just from recently looking at it, any programs that are over 52 weeks are pretty much out at this point.
Because that's a year-long program. And we're probably down to, what, 5, maybe 6 months?
I can tell you exactly. I have my fancy calendars here. It looks like, so as of today, we hit the 52-week mark. So the 52-week long training programs would have been closed down this week.
Okay.
But we won't close them if you're going to be co-enrolling them. So if they're going to start with EPIC and you're going to pay for the services through EPIC until the end of EPIC, and then you're going to roll them over to WIOA or some other type of a training program, then those can still stay open as long as we know that that program has something to support it after EPIC's done.
So you just need to talk to us.
Yeah, you need to communicate with us, yes. So if a program's longer than what EPIC is going to allow, then you need to let us know that you have a backup plan or you have another funding source that's going to continue it on.
All right, I see Judith typing. I don't want to leave her hanging if she's got a question here. Yes, you can. Roll a participant from EPIC to WIOA. Cool.
You can co-enroll.
Right.
You don't even. I mean, you can roll them if you want to start them in EPIC and then get them to a certain point and then put them in WIOA, or you can put them in both at the same time as long as you're doing very distinct services. These programs paying for the. So, you know, my recommendation would be that EPIC pays for the entry-level services. You know, the entry-level credentialing and training that sometimes WIOA doesn't like. So, you know, like a CNA or you know some of the three that WIOA specifically doesn't recognize is the Food Handler Certificate, CPR, and OSHA. It does not recognize those as credentials. But then I know,
Carmen is asking, is there going to be a lag time for performance at the end?
There, you know, we have the 90-day closeout period. So, you know, we can go definitely to the 90-day closeout period for performance. The problem is once the grants close, they're closed. So, and then of course, you know, the evaluation team is going to be evaluating this for 2 or 3 years after that. So I would say what you want to plan on your customers being completed, either completed with training or they're going to be enrolled and continue training at the end of February, or by February you want to have them employed, and then retention can happen during the closeout period.
All right. I still need to know if Bonchan & Bon is going to be the primary customer contact for Central State, Who is going to be for inspiration? Is it going to be Margaret or D'Amico? Who is it going to be for Instituto? And who is it going to be for JARC? And I got failings. Okay. So let me know on those 3 agencies who's going to be the primary customer contact for DHS. All right. All right, so I'll watch the chat pod once we're done, and then I'll get those numbers. Thanks, Margaret. And we will update this list. And then please check this list to make sure that I've got the right people in the right place. Tammy, did you happen to pick up the list from Chicago with the that I had from the database with who was still current and who wasn't?
Let me take a look.
I
do have it. I have it. So I'll scan and send it to you.
Okay. And we're going to do EB for JARC. All right. And then who else did I still need? Central State. I'm making it Bond. Oh, Instituto. Fritz, and I kind of thought Fritz and then Pauline. Okay, so that's good. Nellie, okay, I figured. I just wanted to be sure. And then Kelsey, I'm making you primary since Carmen's pretty far away. Won't see him every day. All right, now make Mary. Okay. Okay. All right. All right. Of course, Kelsey. Yes. All right. Okay. I think we're done for the day. Yay! All right, everybody have a great rest of your day. The sun is out where I am right now, so it will be out for you guys in Chicago soon. We'll talk to you as always. If you have any questions, please email Olivia, myself, or Tammy, and we will get answers back to you as soon as we humanly can. Have a great rest of your day.